Good morning, good afternoon, good evening. It's a huge honor to be here. So let's go. We have not enough time, probably. Vaccination as fast as possible. Challenge for low and middle income countries. These are my disclosures. And these are today data. It's more than 7 billion doses of vaccine administered in the whole world. Total cases, you can see here the numbers, but the numbers here that are very concerned is 5 million deaths. And you can see here the curves of weekly cases from the very beginning of the pandemic and weekly death. And you can see the vaccines. And this it should be rising, but it's dropping. And that's the very first concern, because this should not be happening, because more people should be vaccinated. But let's go back to the beginning. How was this possible? Where the money came from, where the effort came from? The very first initiative was the Operation Warp Speed from the United States. The former president of the United States, on April of last year, started this initiative with facilitate and accelerate the developments and manufacturing and distribution of COVID vaccine, therapeutic and diagnosis. What it was the aim? 300 million of doses of safe and effective vaccines available from January of this year. They reached that aim, but there was also concern, a very big concern, because this initiative was thinking only in United States population. So what's going to happen, and this was the concern about logistical concern to access vaccine outside the United States, may be restricted during 2021. And is that happening? Are we going through that process now that low and middle income countries have no or minimal supply of vaccinations? So after that United States initiative, this second one, and this is the most important one, the kovacs one, and this start with CEPI and Gavi, two already existing initiatives. CEPI is the Coalition for Epidemic Preparedness and Innovations that aims to accelerate the developments of vaccines. Before COVID, before this pandemic, they were working in vaccines against emerging infection disease that need to be available during outbreaks. And Gavi, it's the Vaccine Alliance, helps vaccinate almost half of the world children in the world. So these two institutions, plus UNICEF and the WHO, start to create a plan to stimulate the production of vaccines and the distribution of the vaccine. And then later, it moves to the ACT accelerator, the access to COVID-19 tools. We're not talking only here about vaccines, we are only talking about therapeutics and diagnosis, 2 billion doses at the end of this year. So together, governments, scientists, business, civil societies, philanthropists, and global health organizations, where Bill and Melinda Gates have the main position here, start collaborating all together, also with UNITAIDS, with the Global Fund that we know from HIV, to access and allocate vaccines, also diagnosis and treatment, as I told. But how was possible this? How it was even possible to have a vaccine is in this publication from Nature, we can see that it usually takes around 15 years or longer to get a vaccine. But now for COVID, in less than 1 year, actually in 10 months for the first one and a year and a half, we already have a vaccine. Well, that's because there was some pre-existing work done for SARS-CoV-1, we can say, or for MERS-CoV. That scientists were working on those vaccines before, and also because there was this overlapping in clinical phases. That was how it was possible to have this vaccine so fast. So what's going on with COVAX? COVAX offer doses for at least the 20% of country's population for the poorest population in the poorest countries, diverse and actively managed portfolio of vaccine. And that's why COVAX is distribution different brands of vaccines in different platforms. Vaccines deliver as soon as they're available, and the end the acute phase of the pandemic. I'm not sure if we already passed the acute phase of the pandemic, and rebuild economies. And so far, they have shipped over 435 millions, but remember that the aim was around billions of doses to 144 countries participants. So there's still a long way to go. What happened with WHO data? They say that almost half of the population in the world has received at least one dose of COVID vaccine, and 7 billion doses have been administered globally, but and 26 million per day, more or less. But what happened here? Only 3% of people in low-income countries have received at least one dose. And this 49 is because in many countries, they have received 2 doses and actually now maybe a third dose. And you can see here data, and this I choose the 10 of the 8 poorest countries in the world. And you can see in Mozambique, the coverage is 8%, and in Democratic Republic of Congo is less than 1%. And you can see Central African Republic, Liberia, and Afghanistan are in between these very bad numbers. And then we move to the richest countries in the world, Singapore, Brunei, Denmark, Norway, and they're around 80%. And you can compare here from the previous countries that I already mentioned, the huge gap in coverage of vaccination. And again, in this graph, you can see high income countries, what's the doses administered by country income group, and you can see the difference between high income country, upper middle, lower middle, and low income country, and is extremely uneven distribution. In August of this year, United Nations, the International Monetary Fund, World Bank, World WHO, and the World Trade Organization call a desperate call for international commitment and support that every country would have vaccinated at least 40% of their population at the end of this year. Is it 40% enough? Actually, it's not. One dose is enough? We know it's not. And here you can see I'm coming from this country, from Chile, that is, we're lucky to have very high vaccination rates. We are the luckiest in our region, but you can see this huge, almost white spot here that it's Africa, because the numbers there are extremely bad. And just last week, we saw the G20 leaders open with a call for more vaccine for poor countries. Guys, you are the rich countries. We need your help. Every country needs of these 20 richest countries to help the poorest countries. So finally, WHO says everyone, everywhere who could benefit from safe and effective COVID-19 vaccine should have access as quickly as possible, starting with those at the highest risk of disease or death. So what's going on? Back again in the vaccines numbers. There are already 8 vaccines approved around the world, 15 authorized for different approval offices, 10 vaccines that drop in the way, but there are many vaccines that are in the way, phase 1, phase 2, phase 3. We need many different vaccines for different populations, and because there are some market issues and some geopolitical issues for the distribution of vaccine. You can see here the most used vaccines in the world: CoronaVac, Pfizer, Sinopharm, AstraZeneca, and Moderna, and a little in the back, Sputnik and Johnson & Johnson. This Bharat BioNTech is only in India, but you can see which country are buying the most. And you can see that kovacs, that should vaccinate 20% of the poorest people in the world, it's buying a lot less than 20% of the vaccine production. You can see India, but you can see European Union, but small countries, lower middle income countries, you can almost don't see them. And here, if you go by vaccine, Pfizer, AstraZeneca, Moderna, and Gamaleya, the Russian vaccine, you can see there is some weird distribution. There are some vaccines that are not distributed. For example, Moderna is almost not distributed under the Ecuador, and you don't see in the undeveloped or developing countries. Pfizer vaccine is much more well distributed, and you can see in Latin America and South America, we have received many Pfizer vaccine, the same as AstraZeneca. And Gamaleya, you don't see Gamaleya in Western Europe, or you don't see Gamaleya in United States or Canada. So maybe, I don't know, I'm not a politician, there are some reasons there. And where Chinese vaccines are used, and remember that Sinovac and Sinopharm are one of the 2 most used vaccines in the world, and you can see they're all used in the Southern Hemisphere, and of course in China and countries around China. But are these good vaccines? They are recognized by the WHO, so we have to believe that they're very good vaccines too. And you can see here the biggest takers of Chinese vaccine: Indonesia, Brazil, Pakistan, Turkey. You can see the list here, and they're all countries, developing countries, they're not rich countries. And what happened with this Chinese vaccine? They were very good at the beginning and were the way to get a vaccine. But here you can see the vaccine have been crucial, but now its immunity is waning. And you can see here, this is publication, Lots of Infectious Disease from my country, from Chile, where you can compare the titers of antibodies, IgG antibodies from Sinovac vaccine, how it's dropping against Pfizer vaccine that is staying in adequate levels. Finally, I want to show the experience of my country, of Chile. We start at the beginning of February this year with the vaccination. Sorry, it is Spanish because this is official graph. In purple, you can see the first dose, mostly Pfizer, but mostly Sinovac vaccine, the Chinese one. In green, the second round, very few patients with CanSino vaccine. And now we start here with the booster dose. With Pfizer or AstraZeneca. And here in green, when we reach 80% of our total population vaccinated with 2 doses. And here you can see the number of cases from the beginning of the pandemic. We have this huge first wave, and here we start with vaccination. We still have a big wave, and then cases start dropping when we reach 80% of population at the beginning of the end of July, beginning of August. And here you can see the death rates, the number of deaf people, and here the start of the vaccination, and here when almost all people in my country it's vaccination. So now we're starting a very small, I hope, new wave, but death fortunately stay low. Finally, I can show that unfortunately vaccines that are lacking in a lot of parts of the world are being wasted in many other United States, UK, Canada, but also in Philippines, for example. Huge numbers of vaccine are being wasted because of distribution issue, because they get expired, because of logistic. Finally, my take-home message for now, the best vaccine is the one you can access, especially if you're coming from a developing country. So we cannot complain. We are going to receive the vaccines that we can get for the donation from kovacs, or the vaccines we can get, for example, if your country are able to buy it. But whenever any vaccine you can get is the best vaccine. Fair and transparent distribution of vaccines. We don't need nobody to jump in the line, no country or no specific person. Have a clear prioritization of who to vaccinate first. Of course, healthcare workers and people with more risk of severe disease, as old people or people with other comorbidities. Storage capacity is not a minor issue. We need to take care about all the technical conditions that need for safe storage, adequate territorial distribution chain, because it's not that we're going to vaccinate in big cities, we need to vaccinate everywhere. And finally, education and crystal clear risk communication, education and crystal clear risk communication, education and crystal clear communication. These pictures of where vaccines are distributed around the world, look at the difficulties, and thank you very much.